the perfect person to bring in now is Dr. Mary Gillis, because you know Mary always is trying to help us live better lives.
Yes,
I like that.
she does. She is definitely the healthier one of this group, making better decisions. She has this week's health headlines.
Oh, you guys, thanks. Okay, always great being here. Nice to see you, Sierra.
Yes, thank you.
And always pleasure, Alexis. Okay, so the U.S. is getting closer to herd immunity with over 35 million COVID-19 vaccine doses given so far. However, that number could soon stall the efforts as a result of a specific age group. Vaccine skepticism is rising among young, healthy adults. A study published by researchers at UC San Francisco surveyed over 5,000 people between the ages of 18 and 25. 83% of those surveyed indicated they have not been vaccinated. 10% of those respondents said they will definitely not get the shot. 14% said they probably won't. The results of the study, published in the Journal of Adolescence, has authors concerned as this age group has been found to be more likely than any other age group to transmit the coronavirus, putting others at risk of infection or reinfection.
I think that's a big one, Mary. You see this age group everywhere, doing everything.
Right. Yeah, they're all around. They're all around.
They're all around.
They're everywhere.
They're everywhere. Okay, so even moderate drinking, even moderate amounts of alcohol increases the risk of 8 types of cancers, including esophageal, larynx, breast, colon, rectal, oral cavity, liver, pharynx, and esophageal cancer.
Wow.
Researchers defined moderate consumption as up to 2 drinks per day. In a study published in the journal Lancet, alcohol was linked to 7,000 new cases of cancer in Canada in 2020. 24% of breast cancer cases, 20% of colon cancers, 15% of rectal cancers, and 13% of oral and liver cancer. Alcohol consumption causes a substantial burden of cancer globally, said the lead author in a news release, yet the impact of cancers is often unknown or overlooked, highlighting the need for implementation of effective policy and interventions to increase public awareness of the link between alcohol use and cancer risk.
That is interesting, especially hearing all the different parts of your body that can be impacted by alcohol.
Right. I mean, and they're 8. I mean, I knew probably about 5, and I was very surprised about some of those. So
absolutely.
Right. Keep it. We got to keep it low if we can, and it's been troubling this year. But there are resources, and we'll have those on the website, on our website, wishtv.com. All right. Male and female hearts respond differently to stress. Well, in mice, that is. Stress can lead to a heart attack, which prompted researchers to explore the differences in response to stress between male and female mice. According to the study, which authors do say has potential implications for human heart disease, showed that female mice function better under stress compared to males. This is because the stress activity measured by heart neurons was fewer in female mice under stress, and they were able to carry out essential functions with fewer numbers of those neurons. So those are a look at your health headlines.
See, that's why Randall was so afraid to jump off the building. Because we have a bigger, what you say, a heart brain?
It's called a heart brain. Yeah, so the heart has its own brain. And the activity in the female mice under stress, there were less activity.
See?
Any woman knows. We got stress.
We got that. Yeah, there we go.
All right, Mary. Well, thank you so much.
You guys,
a pleasure,
thank you so much.
as always.
Oh, gosh.